will present the molecular basis of ALS and frontotemporal dementia, going from neuropathological findings and also including genetic findings, and providing evidence for new molecular classification of both of these conditions, which have actually in the last couple of years we have identified new disease proteins and disease genes, which turned out that actually there is an overlap of some of these proteins and genes coming up in ALS and frontotemporal dementia, which actually was the molecular basis to come up with these hypotheses that both of these conditions are mechanistically linked. The identification of TDP43, for example, which is the accumulating disease protein in more than 50% of frontotemporal dementia and in almost all cases of ALS. So this is the common denominator of both of these conditions. So this pathology is closely correlated with neurodegeneration. I think that's the key event which is coming up, which is identical for both of these diseases. So that's one evidence, and the other thing is, for example, identification of novel disease genes like the C9orf repeat expansion, which is also the most common genetic factors in ALS, and FTD, which is another molecular evidence for this overlap.